the role of public-private cooperation in the mitigation of GCBRs. Just like the previous sessions, many of these examples and lessons will be from our experience of the pandemic and how industry was involved, and then recommendations how we feel that that industry or the private sector can be better engaged to support a response to potentially global catastrophic risk. So currently, when you look at the existing status of public-private cooperation, globally it is very essential but unreliable. We cannot leave the entire response to the private sector. Just like earlier Dr. Stephen was explaining that private companies have a lot of data regarding therapeutics, regarding infections, clinical trials, but because it is that data that gives their companies value, they're a bit hesitant to share that with the public domain. What that does is that it affects how fast research progresses, especially research in those areas. And with that, then it also makes it harder for the public sector to effectively respond. When you look at the local scene, the cooperation between public and private sector is immature and untapped. So it's not unreliable locally, but it's quite immature because many countries don't have established ways of engaging the private sector in the case of an outbreak and trying to stage a response. However, we have a number of trends suggesting that right now the conditions are quite favorable to come up with an organized framework of developing the public-private cooperation. One of the first trends is that the economic impact and disruption from outbreaks is increasing. It is very easy for a private company to assume that public health matters are a concern for government. But when an issue like the pandemic made it harder for you to run business, for you to export to your clients, for you to get raw materials for your company, then the cost to the company, to the private sector, increases. When you look at the estimated cost of the pandemic, let's look at the outbreak of SARS, which was estimated to cost about 50 billion, with less than 800 deaths. So when you look at the number of deaths and the cost of that entire outbreak, that tells you that there must be other factors beyond the dying that made it quite costly. And that is the economic impact and social disruption. So when you look at these various consequences, I could give you an example in Uganda. Each time we have news that there's an outbreak, of late we have now Ebola, even before the government requires or restricts travel, people feel like we shouldn't travel to Uganda. What that does, tourism industry suffers. So all those running hotels, running tour companies like the safaris, those who manage tourist sites, they're all affected by this. And there's really very huge loss to the country, but most especially to the private sector. And that's just for tourism. So when you look at the pandemic, the losses were quite immense. So because of that kind of factor, that means the private sector is more than willing to engage with government to ensure that such a thing that would potentially cause them losses does not happen or is handled better. And that's closely related to the second point, that the business risk for large companies especially is becoming too big to ignore. You can imagine when lockdowns were instituted, there was limited travel, not only of the goods, but also of the people supposed to use the goods. For example, here in Uganda, we had a policy whereby the trucks that transport materials in and out of the country, they could still move. But then we couldn't access the labs and the workplaces for some cases because you need permits that are, it being a government, is a very bureaucratic process to get a permit. So a lot of processes in the manufacturing are affected, and that increases the business risk for a company. So that then makes more sense for the private sector to invest a little in the preparation or the prevention compared to the potential loss that they could suffer in case they didn't have these measures in place. Third is that the private sector leaders are increasingly becoming accountable for mitigating epidemic risk. What this means is that when Natalie was talking in the morning, there was a small discussion on community leaders. And the main issue there was trust. when you're trying to pass on a public health message, who do people trust? And there are more and more studies showing that people tend to trust their employers more than any other thing, most times. So if the message came from government and maybe the same message came from the employer, or a different message came from the employer, chances are the employee will believe their employer before they believe the government. So because of that, there's an expectation that the employer has to take care of my safety, my security in that sense. So because of that accountability that is increasingly falling on the private sector, there's more will for them to engage in this kind of cooperation. The fourth point is that there are more and more instructive examples of effective public and private cooperation. We have Gavi, the Vaccine Alliance, that is making it possible for the governments and private sector to distribute vaccines to the poor countries. We have the Coalition for Epidemic Preparedness, CEPI, and other similar coalitions of the private sector and the public sector to work on public health challenges. So with those examples and models that can be built upon to establish local and global preparedness, there is really a very good condition that to enable public-private cooperation. And lastly, public-private cooperation is essential for effective global response. For any service, oftentimes you'll find that the private sector does the service better than the government sector. Whether it is transit of goods or communication. In Uganda, we have a telecommunications company by the government, but it is always in and out of bankruptcy. Whereas the private companies are very stable, they have very good network, they have very good reach, and that's a very, very basic resource as communication. But you can see that on almost all fronts, private products and services perform better than the public. That should be more reason for the public sector, the governments, to want to have a very good framework of working with private sector, so that when eventually it comes to staging a response to, let's say, a GCBR, there's more will and there's faster movement in terms of reacting to prevent devastation. So having looked at the trends, there are a few gaps that need to be addressed to make this possible. One is that there are misconceptions between the public and the private sectors, which have proven to be detrimental. These are mainly stem from the expectations. I could give an example of Uganda here when we were responding to COVID, and the government put out a call for donations and contributions from the private sector. Government has had this kind of feeling that because you're making profit, you're obliged to contribute some of it to the response. So they made a clear request that we need cars to transport personnel, which is a very reasonable one, but the manner in which it was made was the manner of, because you can, you should, which isn't the way you build trust. You should be more willing and humble to explain why I should do it, why I should care, and what the benefit is in this case. The other thing is that the private sector expects government also to have huge access to funds. And so there was the expectation that as critical companies in the private sector contributing to the response, government should one way or another motivate or incentivize that kind of cooperation. So there are a number of uncleared perceptions regarding what the government can do for the private sector and what the private sector can do for government that need to be addressed to enable cooperation to work smoothly. The other is that there is lack of evidence and tools for cooperation. Looking at how the pandemic response was, how the cooperation and donation and support occurred was more ad hoc, partly because probably the pandemic was a new occurrence to many of these people. But then it shouldn't have to be the case. There should be a clearly laid out framework for how companies or private sector can support government response, and equally how, in that response, the public sector can make it much easier for the private sector to contribute. An example is how the vaccines were developed. That previously, getting a vaccine to the market would take over a decade of research. Not because the science was slow or because there was no money in the private sector. What caused that delay was of how long it takes for government to look at your application, do the approval, come check out your things and sleep over them and get back to you. Simple things, but for some reason they take 10 years because, it's government. But then because there's now a way to have these solutions reach the public very fast, all of a sudden government could still do the same safety checks, but much faster. So this tells us that this sort of cooperation shouldn't be haphazard or instinctive. There should be a thought process to it, a clear laid out framework to how, in a time of emergency or an outbreak of a GCBR, the public sector plays its part and the private sector plays its part. And also there should be clear expectations. How shall we deal with this? What will be the benefits? What will be the incentives? And of course, all this should be with the goal of reducing damage to human life and also to the economy. The last gap is closely related to the first one, mistrust. It's very rare that people trust government, even if government was communicating the right thing. Government is always associated with conspiracies, with making life harder, all these policies and taxes and things like that, which shouldn't be the case. There should be efforts to ensure that there's a bit of feedback communication from government. Government shouldn't be, because you have the authority, I can block you from doing this, so I don't have to explain why I'm doing some things. I don't have to consult. So there should be systemic efforts to ensure that as we come up with evidence and tools for cooperation, there are actually efforts to build trust. There's clear communication from both ends on what needs to be done to have effective public-private cooperation. So what are the recommendations for strengthening public-private cooperation? I've kept mentioning some of these. One is to prioritize essential public-private cooperation for global response. When you talk of priority, governments have ways of setting priorities. For our case here in Uganda, the government will pass a policy. In recent weeks, I've been seeing an executive order of the Biden administration to spearhead the bioeconomy in the US. So we need to have decision makers, both the local governments and also international bodies, putting in place things that enable partners to prioritize public-private cooperation, that enable this kind of work to happen, even way before the pandemic happened. There should always be these kinds of frameworks. Second is that there's need to make the case and build tools for cooperation. That is closely related to how we can achieve priority. We need to explain the benefits. Lucky for us is that we have, almost all of us, I think all countries in one way or another had to rely on the private sector to manage the pandemic. So what needs to be done is to make sure that these examples and scenarios are not forgotten. It's very easy to get carried away with events. News keeps changing every day. So there is need that, especially the technical personnel, ensure that this evidence is available and acted upon by the governments and other decision makers to have strong public-private cooperation. Third is to encourage a group-based approach. If you are to expect one company, no matter how big of a financial muscle they have, the audience wants to meet the cost of saving the nation alone. And so this makes sense for frameworks that develop groups for companies and also groups for governments. For the case of East Africa, we have the East African community having about 7 countries, and it's still expanding. So we could have a framework that enables countries to share information across borders, and similarly for governments. In that case, then, when it comes to responding, there won't be any huge burden on any particular player because of that shared effort. Fourth is prioritize reducing economic and social impact of epidemics. Oftentimes, when people are thinking of epidemics, they think of loss of lives, and so there is a lot of focus on public health, and then we forget that the impact on the economy and how much it will take for the economy and society to recover tends to be more expensive than the cost of dying itself. And also this economic impact usually comes from the fear, as governments try to prevent falling sick, these drastic measures taken like the lockdown, I feel like, for example, in our case here in Uganda, only waiting for one case and it closed the entire economy. And for some reason, that's how it happened. Yeah. So, with that impact happening, with or without the disease, there's really need to prioritize preventing that from happening. Going beyond, yes, we have the public health of saving lives, preventing loss of life, but also planning for that disruption to how the economy works that then ends up creating losses, destroying livelihoods, people lose jobs all over the place. So once people realize how big of an impact that side is, then to make it much easier for the public and for the private sectors to be willing to work together. And lastly, build trust. The easiest way of building trust is through transparent communication. After my session, we shall be looking at risk communication. So communication from either side, there needs to be an effort that you aren't holding back information from me. I need to be able to trust what you're telling me. So if the public sector aims to cooperate with the private sector, there needs to be that kind of trust. An example here in Uganda is how the cost of treating a COVID patient went up very drastically, especially for the private sector. And government didn't have any particular mechanism that they could use to ask a private player to reduce the cost of treatment. Because I'm paying taxes, you can just charge taxes and wait for your share. However, it was making it harder for the public to access basic healthcare. And of course, private sector was desirable because the public hospitals didn't have some of these things like the ventilators and other medicines that were required for a response. So with that lack of trust and also the lack of prior cooperation that could enable governments to amicably and talk peacefully over the cost of healthcare, Ugandans had to pay hefty sums of money. It went as far as people confiscating dead bodies because the families hadn't yet cleared their balances. So that's how terrible it went. The person has died, you can't bury them because the hospital is still having pending bills, and the government can't do anything to it. Each time the government tried to come in, to always met the same response. It's a private business. You can wait for your taxes. You can't tell me how much I'm charging my clients. And they pay willingly. You have to pay willingly. It's not like they've gotten you from your home for treatment. So there were lots of escape routes for private companies. However, if there had been efforts to build trust between these two sectors, wouldn't have had to take high-handedness to get the public sector to bring down the cost. And there could have been discussions on how to incentivize this whole process so that the private sector still gets all the things cheaply, and that's been in position to provide the healthcare cheaply. So I would like to thank you for your attention and open up the floor for discussion. Thank you.
Thanks very much for that, Ian. Just want to add a few points to that, particularly that last point about the economics of it. The pandemics have been happening since cholera in the Middle Ages in Venice. And in fact, many of the methods we have for responding to pandemic were adopted by the government of Venice at the time. So passports originated at that time to allow people, as a health document, to allow people to travel from Venice to elsewhere to continue their trade. It was like a certificate of health that you which permitted you to travel, and that's the origin. But even from that time, it was evident that pandemics disproportionately impact the poor. And the way it does it is not because their biology is different, but because their economic circumstances are different. And we definitely in the US saw this big time with COVID. One of the hardest hit communities was the Latino community, because they're the poorest, they have the worst housing, most crowded housing. They have to go to work. They cannot stop working. They tend to work in the essential industries. They have to use public transport to get to work because they can't afford cars. So they're the most exposed, living in the worst conditions, and with the fewest resources to actually protect themselves. So I think what you said about this needing to have that discussion with private industry is very key. The discussion has to involve transport, because transport is where people come together during pandemics, those people who have to move around. We have to have the discussion with employers. How can we, to the extent possible, encourage work from home during pandemics? Some people can do it, others can't. There are certain essential workers who have to go to the place of work. But how can we minimize the number of people who have to move around during a pandemic? You talked about government and the hospitals and government and patients having a sort of freeway argument. Again, it's much easier for rich countries to do this than for poor countries, but how can governments think about providing financial support to each of the players, whether it's the individual workers so they don't necessarily have to go to work, whether it's to the transport companies so they can provide safer transportation, whether it's to the employers so that they have some relief of how their employees are paid. All of these things are things that can be in the mix